I'd like to begin by welcoming you to the Therapy Show, a podcast series that seeks to explain the leading forms of psychological therapy to the average person. We will be doing that by interviewing the professionals who develop those therapies so that we can better understand when to use them and how to get the most from therapy. Today, I'm honored to welcome Dr. Eric Yarbrough, author of Transgender Mental Health, a book that seeks to educate mental health clinicians on how to address the needs of the transgender non-conforming community, and thus increase their access to mental health care. Dr. Yarbrough, welcome to the Therapy Show.
Thank you so much for having me.
Can you start by telling us a little bit about your personal background and professional development that led you to your work with transgender non-conforming individuals?
I'm from Alabama. I grew up in the South. I was born and raised there. I went to medical school in Alabama. And I came to New York to do psychiatry residency. Throughout residency, I wanted to specialize more in LGBT health, really focusing on gay mental health, which was, I guess, very important to me then. It still is important to me now. And while at my residency program, I guess because I was an out gay man, people started referring to me transgender identified people. I guess because it kind of falls under the same umbrella as anybody that's LGBTQ. And I started working with them. I said yes to referrals, and I learned about it. I read about it. I got supervisors that helped me learn about it. And over time, it became a specialization of mine. I ended up going to a place called Callen-Lorde Community Health Center, which is in Chelsea and Manhattan. And they work almost exclusively with LGBT people. And from there, I started working with hundreds to probably close to 1,000 trans-identified people.
How would you briefly explain transgender mental health to a non-professional?
I really think it's kind of a stance that you take in therapy. So a lot of people in treatment in the past, if they went to a psychiatrist or a mental health worker and they said they were transgender or gay or lesbian or anything, the therapist might try to change them. So they would look at it as a point of pathology and try to correct that pathology. We've come a long way since then, and it's a lot different now, and that conversion therapy is actually being banned in many states, if not most states at this point. And when you go to a therapist who provides transgender affirming therapy or gender affirming therapy, they take the stance that gender diversity is a normal range that happens within the human condition, and that people that are not in the categories of male and female or in both categories of male and female are not necessarily pathologic in any way, and we want to support that and validate that.
Can you explain what the term TGNC means?
Yeah, so TGNC is transgender, gender nonconforming. People also say TGNB, gender non-binary. And transgender is just an umbrella term, and it covers pretty much all those categories. So if someone says they're transgender or they might work with transgender people, it could mean any of those things. So non-binary or gender non-conforming, I guess historically you think of gender as two things. You think of male and female. And really sex is kind of two things, male and female, but there's a lot more to it than that. There's all kinds of different chromosomes and the way people are expressed as far as their physical nature. And then when it comes to gender, it's a lot more complicated. So what we call masculine and what we call feminine, it's more of a spectrum, I guess is the best way to put it. So how masculine and how feminine someone is, which they can be both. They can be largely on one category or the other, or they can be neither. And as we're exploring gender and understanding what it means to people, we're figuring out, I guess, how much of it is culturally based and how much of it is hormone based. And people that are gender non-binary or gender non-conforming try to break through the mold of what's traditionally male and female.
So when and how did you realize that transgender mental health would be an important focus in delivering effective therapeutic interventions to transgender non-conforming clients?
It was when I was working at Callen-Lorde. So when I was there, it became kind of everyday work for us to work with trans-identified people. And when I went to conventions and met other psychiatrists, it became quite clear that not a lot of psychiatrists know how to work with them, and they still kind of see it as a pathology. It is still in the DSM, which is a longer story. But a friend of mine approached me and said, you know so much about this subject, you might as well put it in a book because there's not one from the American Psychiatric Association. And that's when I started collecting all my information and wrote the book. People need access to care. So trans-identified people, they need mental health treatment, but they also, because of diagnostic reasons and insurance reasons, need letters from therapists and psychiatrists in order to get access sometimes to hormones and also to gender-affirming surgeries.
And can you say a little bit about the DSM-5 and the term gender dysphoria? Because I think it can be confusing to people that it's in the DSM-5.
Yeah, absolutely. It remains a debatable point. So it used to be called gender identity disorder, and the disorder was removed and changed to dysphoria because disorder implies some sort of pathology. Dysphoria just means that someone that is, I guess, assigned a certain sex at birth, as they grow up, they become uncomfortable with maybe their sex identity, what people call them, their secondary sex characteristics, so things about their body that make them uncomfortable, and they can fall into the diagnosis gender dysphoria. Psychiatrists debated about whether to leave that diagnosis in the DSM, and I think it was ultimately decided to leave it in there mainly for access to care reasons. So if you took it out of the DSM, insurance companies might not even pay for gender affirming surgeries, they might not pay for hormone treatment. And so it was kind of a what's the least amount of harm we can do and the most amount of good at the same time.
That makes sense for reimbursement purposes. When and how did you realize that transgender mental health would be an important focus in delivering effective therapeutic interventions to transgender nonconforming clients?
I think it was 2012, 2013 that public insurances started paying for gender affirming surgeries. And transgender identified people are now going to treatment in order to get access to this care. And people need to understand basics of transgender psychology and mental health. They need to understand the transition process and what that means. It can be multi-directional and not necessarily going one way, and people can fall under all kinds of different categories of transgender. And if a therapist or a psychiatrist or any mental health clinician isn't aware of how to work with this, I guess they could do more harm than good in some ways. So having some sort of resource available to people or as much information available to people is to try to help therapists and mental health workers guide these patients and provide them some sort of good.
So, who's transgender mental health treatment most effective for?
It's almost like another stance. So if you think about Kinsey in the, I think Kinsey was in the 40s or 50s when he released his books on this, the sexual health or the sexual behavior of males and females. And people started to think of sexual orientation as more of a spectrum than a binary. So people weren't just straight or gay, people were straight, gay, bisexual, and then usually somewhere on that line in between. Gender is the same way. And so now people are starting to be seen based on not necessarily being male or female, but some sort of spectrum of how masculine or how feminine they are. The ideas that you apply to transgender people when you're working with them, you could apply to any of your patients. And it's probably good to do that because I think a lot of our work we do with people, we continue to assign our own beliefs and biases onto them. And we have to be aware of what's going on in our head and what we think of ourselves and what we think of our patients. And taking a stance of looking at people as a spectrum as far as their gender and sexual orientation, that's just going to give the patient the most freedom to express themselves and to figure out who they are.
What's the average length of treatment for somebody working with a transgender mental health informed therapist?
It varies. It could be anything from a one-time visit, which I've done, to weekly to twice weekly psychotherapy for a long period of time. Now, you have a population that has been dealing with a lot of stigma, hate, even from people in this country and around the world. Transgender people are attacked in the street for no reason. They're murdered for no reason at all other than who they are. There's a lot of trauma built in there. So people come to treatment usually with a lot of trauma. They come from unaccepting families. Sometimes they've been kicked out of their homes and have nowhere to live. So there's all kinds of different things that can occur in a trans-identified person, not because of them being transgender in itself, but because they're transgender in the world that we're living in now. Meaning, hopefully in the future, when people are more accepting, then these same problems won't necessarily exist.
So oftentimes, therapists and psychiatrists may act as gatekeepers for transgender clients. Can you tell me a little bit more about that?
Yeah, I know it's created quite a strain on mental health and its relationship to trans-identified people. So say someone comes to my office that's trans-identified and they want to have a gender-affirming surgery. According to their insurance company or even the surgeon that's providing the surgery, they might have different requirements. So they might need to see me for a one-time visit for me to do an evaluation, or they might need to see me for a year in weekly psychotherapy, which certain insurances actually require that, which is a whole nother subject in itself too. So if someone talks to me and wants surgery, depending on me and my stance with trans-identified people, I can be very helpful to them and try to facilitate that, or I can say no because of a variety of reasons. I can be like, oh, well, you're not on medication and you're depressed, or you have mood problems and we need to get that taken care of first. And I think that a gender affirming mental health care worker will be able to tease apart what's mental health issues and then what's trans identified issues. And if someone's looking for access to care or access to hormones or access to surgery, you have to be mindful of that power differential that takes place. So patients might not want to disclose a lot of information to you out of fear of you denying them access to some sort of care. And I usually tell people when I first see them, I mean, if you go to my website, it says that I'm LGBTQ affirming, and that's usually enough information for people. But I tell them when I'm interviewing them that, my goal is to help them become whoever they want to be. My goal is not to pathologize any part of their gender diversity. And the way that I can help them most is if they are honest with me about their symptoms and what they're dealing with. And just because they might have a certain diagnosis, it doesn't preclude them from getting access to care like surgeries or hormones.
What skills, habits, or tactics can clients and therapists adopt, either during their sessions or in between sessions, to improve the effectiveness of their treatment with a transgender mental health informed therapist?
I think it's really from the part of the therapist and the patient to take each meeting and each conversation with an open mind. A lot of people, they have an idea of what transgender means. The most common understanding is, oh, someone is identified male at birth and they're transitioning to female, or identified female at birth and transitioning to male. Well, it's a lot more complicated than that. Some people might want to transition, meaning change their gender identity. Some people just might want hormones. Some people might want surgery, and some people might want all three. And some people might not want any of them. There's no one formula to apply to a trans-identified person. You have to take each case individually. It's against what we're taught in medicine. So in medicine, we use previous patient experiences to kind of understand and diagnose and prescribe our current patients that we're working with. And with gender diversity or even sexual orientation diversity, you can't really do that as much other than look at that each new person you meet falls somewhere differently on that spectrum. It's really important to look at each person individually, listen to what they want, discuss with them all the options that are available to them out there, and then see what feels best. And sometimes that might take time to figure out, and some people will come into therapy already knowing exactly what they want.
What are the most common obstacles or missteps that prevent therapists and clients alike from seeing the full benefits of treatment with the transgender mental health informed therapist?
It's what I was talking about before. It's projecting your own biases on the people. If you're talking to someone who's trans-identified, or just say non-binary, so someone that says they're non-binary comes to your office, and you start trying to put them in a box. So in your head, you think of the person as either male or female. And it's important to think about, why am I doing that? And is this going to help or hurt the person? Approaching each person like that, you just have to be aware of what you're saying and what you're doing, and making sure you're not assigning your own beliefs onto the person. So that's the major misstep. It's not listening to the patient of where they're at and what they need and trying to figure that out for yourself.
Can you share any poignant examples where working with the transgender mental health framework had a major impact in someone's life?
Yeah, I'm fortunate to be in a place of working with people long term. So I've seen people go through a transition process or work on trying to figure out who they are. And when they get to a point where they're happy with their bodies and they're happy with their minds and where they are in life as far as their gender identity, it's nice to see them move on to something else, so to speak. So being transgender or gender diverse will always be part of who they are, but thinking about, okay, I've got this in a place where I want it. What do I do next in life? What do I want to do for a career? What do I want to do for relationships? That's fun to work with people because you get to see them kind of leave a place of stigma and go to a place of freedom. And it's a lot of fun to work with that.
Can you share about a specific client without, of course, any identifying information, maybe a client from your book or any case studies?
I guess it's going to be hard to do it without divulging too much information, but I work with a lot of professionals, and these are people that are middle age or over. And so they spend a lot of their lives denying who they are or suppressing who they are to have families or to have jobs. And now they're in a place where they can explore who they are more freely. And when you give them the opportunity to do that, where you validate them and encourage them to kind of figure out how they want to present themselves to the world, it's a lot of fun to watch because people become so happy and a lot of their symptoms start to fade away when they become more in line externally with who they are internally.
So they may go from being depressed or anxious to being free of the disorder that perhaps may have been the result of suppressing who they were. Is that possible?
Oh yeah, absolutely. There's a lot of symptoms that we know come from people transitioning. So any LGBTQ person who is either coming out of the closet for sexual orientation reasons or gender identity reasons can express symptoms of mood lability, so the mood swings, or being impulsive or even suicidal ideation or suicidal thoughts. And that's common for people who are in a transition process, so people who aren't in a place where they're stable with their identity and who they are. Once they get in a place where they are, and once they get in a community that's validating of them, a lot of those symptoms tend to go away without the need of medication. So a lot of people do get overdiagnosed and overmedicated. You got to think about people when they're transitioning, when they get to a place where they're comfortable, reevaluate the need for medication and make sure that that wasn't just a process related to their transition.
So who is transgender mental health treatment not appropriate for?
I can't think of anybody that I would list as inappropriate. I think that any therapist that works with any client and thinks of gender diversity is probably doing a good thing.
What are you most excited about in mental health treatment today?
I am very happy that people are becoming more open about their mental health care. Movie stars and TV stars and people are discussing more their own mental health treatment. So to say I see a therapist or I see a psychiatrist doesn't necessarily mean, people think, oh, they're going to think I'm crazy. That stigma is starting to go away. So it's almost seen as if someone's doing that, they're working on themselves and trying to better themselves, and it's looked at as a good thing. And I'm hoping that trend continues. And so it's demystifying and destigmatizing mental health care, and it's nice that people aren't so scared to go see mental health care clinicians anymore.
Anything specific to the transgender community?
With a number of people that are coming to care now because insurances are giving them access to hormones and surgery is skyrocketing. So most clinics in New York City, for instance, that are trans focused, they're overwhelmed with patients and they are turning them away because they can't take on anymore. And there's just not enough people out there to help them. There are people that are learning about this subject matter and people are studying it. And I think that day by day, the number of clinicians who are competent and working with trans people is increasing. And that's really what we need. We need as many people as possible to learn about the subject and to offer treatment. It's really not a complicated thing. There are certain diagnoses in psychiatry that can be quite complicated to work with. And working with these diagnoses can mean you take on a lot and it can be stressful. But trans-identified people, it's more just about understanding what gender diversity is, what a gender spectrum is, and then understanding what treatments are available. And once you do that, I think that you can become a provider. You just have to have an open mind and listen to what the person's saying.
If you had a magic wand and could improve one thing about transgender mental health treatment today, what would that be?
The diagnosis is a big problem, and it's still going to be a big problem for a while to come. What do you classify someone who's transgender as? How do you get insurances to pay for certain treatments? Does it need to be under a mental health diagnostic category? Those are all questions that I think are quite complicated, but I would like to see a way for people to get access to care and not be labeled as having a mental illness. And that would be ideal, I think, for everybody in the community.
How can my audience learn more about transgender mental health, either online or in print?
If you really want to learn a lot about working with trans-identified people, the best place to go, besides my book, of course, is WPATH, so WPATH. It's the World Professional Association of Transgender Health. And they are an online community full of, not just an online community, they meet in person too, but it's a collection of gender affirming specialists from around the world. And they write guidelines on working with trans identified people. They meet every couple of years and they revise these guidelines. And these guidelines are free to anybody that goes to their website. So that's how I learned to work with trans identified people, by reading their guide. And it really goes over everything from psychotherapy to hormone treatment to surgeries, what they think people should be required as far as letters go. It gives you treatment guidelines for working with sexual orientation and gender diversity. So I would really go there and invest in reading those guidelines.
Dr. Yarbrough, on behalf of myself, my listeners, and all of the people you have helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand the field of transgender mental health.
Thank you so much. It was a pleasure.
I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so that you, someone you love, and people around the world can benefit more from therapy. There is no need to suffer in silence. Get the help that you need to create the life that you want.